Best Med medical scheme understands that you need personal care that adds value to you and your families. With this understanding of individual and collective needs, Best Med has put together power-packed episodes of content that can help you and your families in the event of an emergency. We know that sticks and stones and jumps and falls can break bones. So today we're going to wrap our heads around fractures. I am Carmen.
And I'm Dr. Enrico.
What are the most common types of fractures that you can get?
So in small children, the most common fractures are firstly the green stick fracture. And in that situation, the bone bends, and because it bends, the one side fractures and little splinters come off. The next most common is a buccal fracture, where we have a force that hits the bone at the same in the same direction as the bone travels. And because one side of the bone is slightly weaker than the other, one side fractures and the other side stays intact. One of the more serious fractures that occur in children is those that affect the growth plate. Because if you affect the growth plate, that's going to affect how the bone continues to develop and may ultimately affect what a child looks like once they're grown up.
In your experience, what bones have you seen that are more commonly broken in kids?
So I think when one thinks of this, one thinks of a child falling out of a tree or maybe a jungle gym. And the most common instinct is to put your arms out and maybe use your lower limbs to break the fall. So the most common places we're going to see fractures are maybe the wrist, certainly the forearm, elbows. Fractures of the humerus are not as common. However, fractures of the collarbone are more common. And that can even happen during a difficult childbirth or during a fall. And the lower limbs, we have the ankles, the legs and the thighs that can be affected. Hip injuries are not as common unless they're extremely high impact injuries.
What are the signs and symptoms of a fracture then?
So, with little Johnny either falling out of a tree or otherwise a jungle gym, or maybe coming home from school and complaining of a problem. Can be as simple as pain, can be swelling, can be deformation of a bone, can be loss of function of a limb or localized pain depending on where the injury is.
What should parents do if they suspect a fracture?
So if there's an injury of the skull or the neck or the spine, or if there's a serious injury of the long bones of either the upper or lower limbs, one must make the child comfortable. Do not move the child. Do not try and put the bone in the correct position. Do not fiddle with an open wound. You make the child comfortable and get the emergency services to the site to help deal with the problem.
So say now the parents have taken the child to the emergency room, they've applied a cast or a back slab. What advice do you have for parents? How should they take care of the limb now in the cast?
There may be very specific requirements from their doctor or their orthopedic surgeon, but the basics are that a limb that is injured can swell. So we've got to elevate the limb. So we'll pretend this is the limb, elevate the limb, and we've got to look out for various signs that things might be going wrong. So there may be whitening of the color of the fingers sticking out of the cast. They might go blue, they might swell severely, they might be extremely painful, or even worse, where there's no pain, medical help is urgently needed at that point in time. Then regarding the cast, please don't go putting knitting needles under the cast to get rid of the itch. Try and distract the child or deal with the itch in other ways, maybe even an antihistamine, because if we start dealing by scratching skin, infection becomes an issue, which ultimately is another warning sign if there is an infection. If the cast starts smelling, or if there's any pus visible or any blood visible, or should you by chance maybe wet that cast, the cast has to be dealt with immediately at that point in time. Then bathing is an issue. If you're fortunate enough to have people who provide orthopedic appliances, there are specific appliances that one can use to cover the limb before you jump into the shower or the bath, which is extremely useful. But if you're in an area where that's not available, just a plastic bag over the cast and some firm rubber bands, and then when they jump into the bath, preferably in that setting, put a towel on the side of the bath so that they can rest the arm comfortably and keep them comfortable. in the bath at that point in time.
Thank you so much, Dr. Rico. I'm sure many parents out there will find this very, very helpful.
It's my pleasure, and I hope they get some good information out of this program.
Look out for more best care tips from Best Med Medical Scheme, from first aid to choking, allergies, and so much more. Thank you. I'm Mom Doc, and goodbye.